What's up, everyone? Dr. Dale here. Real quick, just want to go through and review with you two articles that I think have pertinent information to each and every one of you out there. Highly recommend you pass this along to your friends and your family members, especially people if they're taking cholesterol medications, and I'll tell you why here in a second. I want to read this first article here, parts of it highlighted. It says low vitamin D linked to heart disease and death. There was a study done in the American Journal of Cardiology, November 7, 2011. This article you can get off of Reuters Health, so you can Google it there. But what they said here is the University of Kansas did the research. They found that those people who were deficient in vitamin D had a threefold higher likelihood of dying early, and that was specifically from any cause than those who weren't deficient. So if you were deficient in vitamin D, higher likelihood of dying early. Specifically, they said it increased your risks of diabetes. You were 2 times more likely to develop diabetes, 40% more likely to have high blood pressure, and 30% more likely to suffer cardiomyopathy, diseased heart. Now I'm going to bring some common sense in here, okay? They said that, here in a second I'm going to show you some common sense. D deficiency also nearly doubled a person's likelihood of dying, whereas correcting the deficiency with supplements lowered their risk of death by 60%. So they supplemented with vitamin D, brought their levels up, reduced their risk of death, early death. That's a great thing, wouldn't you say? But the only thing I don't like about the article, don't be fooled, because they said you can get vitamin D from enriched milk. Enriched milk has vitamin D2. Vitamin D2 is pretty much worthless to your body. When you supplement, you want to supplement with vitamin D3. Vitamin D3 is the same molecule that your body makes from getting exposure to your skin, direct exposure to your skin from the sun. That's the way God designed the sun, is for us to produce vitamin D, needed for our hormones. It is a hormone, actually. Needed for your immune system, to help fight cancer, for all kinds of cellular functions. So vitamin D is really good for you. God wouldn't make a mistake. But here's a concept for you, and I want you to think about that. Would God make a mistake by making your body produce too much cholesterol? Okay? Here's a compare and contrast, okay? Maximize Living provides a supplement, a vitamin D supplement. This is just one brand, you know, that actually you can vitamin, it's D3, and it costs about $23 a month. You can reduce your likelihood of dying early, as well as other factors, flu, diabetes, heart disease, those things, according to their research, by supplementing. That's the University, or the American Journal of Cardiology saying that, not me, okay? But it would cost $276 a year to supplement with a full month's supply every single month. That's $276. Now I have a patient actually been prescribed cholesterol medications. Okay, and first off, you ought to ask, do cholesterol drugs do any good? Well, they already asked the question. Here in Business Week, this is back in 2008, they were looking at Lipitor, Crestor, these cholesterol medications, and what they found, they took the largest studies out there. What they found, these are medical doctors here saying this, they said they found no overall reduction in total deaths despite lowering somebody's cholesterol. So it didn't lower death rate. They said it didn't even lower deadly heart attacks. So it didn't even save people's lives at all. One doctor in here, read this, he says that resources are not going to interventions that might be of benefit. That's Dr. Golomb, professor at the University of California at San Diego School of Medicine. This is a medical doctor saying that cholesterol medications, you shouldn't waste your money on them. Yet it's a worldwide business that earns pharmaceutical companies $30 billion. That's how much money they make on this. I had a patient taking this medication. Oh, not to mention the side effects of the medication. So it does lower your numbers on your blood test, but it doesn't benefit you, doesn't extend your life. It does, though, cause serious side effects, such as muscle wasting. Quick question for us. What's the heart? It's a muscle. I don't understand how people think that cholesterol medications are going to help your heart when it causes muscle wasting. Another thing is, it impairs cognitive function and also sexual dysfunction. No one would want that. So let's go on here. Let's think about this real quick. You have vitamin D, something that God made our body to provide. So if you're out in the sun, you need about 3/4 of your skin exposed to the sun. You can't wash immediately after because you're going to wipe the oil off your skin. You can't wear sunscreen, and you can't get sun through a window. So if you're in your house or something, or next to a window, you're not getting vitamin D because the UVB rays are blocked by the window. So little tips there. And again, you can't wear sunscreen to be able to produce vitamin D again. But let's compare and contrast. Again, look at the finances. Where's your healthcare dollar best spent? Vitamin D, something that actually reduces your risk of several conditions: diabetes, heart disease, cancer, the flu, among others. And then you got a cholesterol medication that lowers your numbers. Again, the article said doesn't reduce your risk of mortality, then has side effects and costs. Get this, I had a patient paying $190 every single month to actually take this cholesterol medication. Okay, that's $2,280 every single year he spent on that medication, yet it wasn't doing him any good. And that's not me saying it, that's the article, that's the researchers, that's the medical doctors. Let me grab that article. And this is why. I'm going to tell you why, because I had patients, many people ask me, why would my doctor, or why would somebody prescribe me a medication that does nothing for me? Well, Dr. Hoffman at the UCLA says the way our healthcare system runs, it's not based on data, it's based on what makes money. So it's because pharmaceutical companies can be patented, pharmaceutical drugs can be patented and sold for high prices. Supplements, they can't be patented. A lot of different companies can sell them, thus it drives the prices down. That's the reason they're not promoting such things as vitamin D. So common sense would tell us, spend your money where you're going to get the best bang for your buck. So you know what, get out there, get a healthy, a quality vitamin D3 supplement, start supplementing, reducing your risk of several different conditions. Be healthy, be well. And again, I'm Dr. Dale Brown. I'm going to be bringing common sense back to your healthcare. God bless everyone.